We'd known since 1950 that smoking is lethal, and we thought from the Cancer Council that it was time to put a new impetus into public campaigning on tobacco. So we went to see the Health Minister, John Day, and we said to him, if we put up some funding for a major public education campaign, will you match it? And slightly to my amazement, he said yes. And that meant that we could start what was then Target 15 and what later became Make Smoking History. The first campaign was an ad called Nice People. The overall consensus was that this is the kind of hard-hitting campaign that you need to cut through. There's no question in my mind that it had a tremendous impact.
Hi, I'm Martin. I'll be your consultant whilst you're having treatment for lung cancer.
Hi, I'm Mark. I'll be your surgeon.
Over the past 2 decades, we've made 15 campaigns, with countless brave West Australians sharing their personal stories to warn others of the heartbreaking consequences of smoking. We've found these testimonials and campaigns from real people strongly connect with smokers and their families. They're the driving force behind quitting attempts, or even encouraging people to talk to their families, friends and their GP about quitting.
I can remember the cigarette that gave me lung cancer. I was 32.
You are my candy girl, and you've got me wanting you.
I just can't believe it.
I've stopped smoking for 3 years now, and I've saved about $32,000.
Campaigns are only one part of our work in tobacco control. A key component has been providing advice and guidance on policies that restrict the sale and use of tobacco at a state and national level.
It's so easy to forget what things were like even 20 years ago. Smoking was much more commonplace. We didn't have the same smoke-free measures that we had then. There was much more by way of tobacco promotion. We didn't have bans on tobacco promotion in retail outlets. We didn't have plain packaging. There was much, much more visible smoking than there is now.
Over the course of time in Australia, we've seen that smoking rates have declined very nicely. However, there's still some priority populations where smoking rates are still really high. These include people experiencing homelessness, people living with a mental illness, people experiencing alcohol and other drug dependence, people in prison, as well as Aboriginal communities as well. We do believe that smoking is a social justice issue, and we are currently partnered up with 20 community and health services across the state to address smoking within these services using a holistic, comprehensive approach. So this includes looking at how we can implement smoke-free policies within the service, how we can upskill and train the staff at these services to be able to have conversations with their clients around smoking and smoking cessation, to make sure that any client that's coming in is asked about their smoking and referred to appropriate support services.
Through these combined efforts, we're seeing the message is getting through. Fewer kids are experimenting with cigarettes. We're seeing more workplaces and councils adopting smoke-free policies and assisting staff and clients to quit. But the battle is far from over. Big Tobacco is not backing down. After decades of lying, manipulation and deceit, they absolutely cannot be trusted. Cancer Council Western Australia prides itself on being an evidence-based organisation, and our decades of work in tobacco control could not have been possible without our funders and partners such as the Department of Health, Healthway and our many donors and supporters.
People now look to Australia as a leader. So what we're achieving here is saving lives in WA, but also contributing to saving lives nationally and even internationally. But smoking's still our largest preventable cause of death and disease. It's still our largest preventable cause of cancer. There's still a lot of work to be done, and it's really important that we do two things. We celebrate the successes, but we don't get complacent, and we make sure that we keep this sort of work up into the future until pretty much nobody smokes.